Well, thank you very much. It's an honor to be invited here to speak with you tonight. And I am the current president of ASCO, and I'm going to talk to you about some of the issues that I'm used to speaking to physicians about, but I know this is a slightly different audience and hopefully get some different perspectives. So here's our polling question. Thriving while adapting to the dynamic changes in healthcare require practice-changing transformations. Identify which is the most important to your organization. So there's no right or wrong answer. This is a poll. Interesting. So a lot of different issues to talk about. We're going to talk about some of these today. So I'm going to talk about this from the physician standpoint and trying to looking toward the future and from the patient-centered standpoint, because that's really what we're all here for. So the ideal, what this picture demonstrates from Norman Rockwell, portrays really the best of medicine, and the reason why myself and most of my colleagues went into medicine, trying to take care of the patient and trying to look back to old times where, in the day it really mattered what the patient felt, what the patient wanted, and we need to try to get back to that. We're all here to help the patient. So this is the ideal in a practice to have interaction with the patient, to, in this case, try to make the little girl happy by listening to the heart from the doll. Unfortunately, this is kind of the reality sometimes in our daily practice as physicians, that there's not the time to have the patient interaction, and we're dealing with a lot of administrative burden. This slide shows a lot of paper charts. Of course, that's not really realistic anymore. Most of it's computer charts. And that's even worse because the computer charts actually take more time, even if you're proficient in that. So we need to try to take it back to the patient, see how we can try to decrease some of the administrative burden and make sure that the physicians are not just data entry clerks, because unfortunately that's sometimes what we feel like. There's polls that ASCO does every year, and in a workforce